Hello, everyone. My name is Justin, and today we'll be going over breathing emergencies, what they are, and how to respond to them. So, the first thing that we can talk about is respiratory distress and respiratory arrest. Um, Respiratory distress is when a person has difficulty breathing, and that could also lead to a respiratory arrest where the person has stopped breathing. And something to keep in mind when a person stops breathing, there it's there's only a short time window where it can cause irreversible damage. So if we look at this picture here, at 0 minutes, right when they stop breathing, and but by 4 to 6 minutes, if nothing has been done, they could sustain brain damage, uh, and after 10 minutes, there's irreversible brain damage. These are just some causes of respiratory distress and arrest. Uh, some common ones that we know of would be choking, illnesses, drowning, uh, and allergic reactions. And then there's also some causes that we may not be aware of, or something that we wouldn't really think of off the top of our head, which might be heart attacks, drug overdose, poisoning, emotional distress, and drowning. And there are plenty of other causes. And so we'll go on to one of the first causes, asthma. So asthma is pretty common, and most of us know one or two people who have it. And we kind of associate this with the inhaler, and the inhaler helps the person uh, take in oxygen that they wouldn't normally be able to do. So asthma is actually the inflammation of the air passages, and then that temporary blocking or like narrowing of that passage makes it harder for that person to breathe and get oxygen. Um, so we have to use something like an inhaler to alleviate that. And this often triggers with exercise, cold air, or allergens. So it's important for people to know what can cause this. And then some signs that someone might be having an asthma attack include wheezing, uh, they're having trouble breathing, tightness of chest, shortness of breath, and they might even be coughing as well. The next thing we'll go over is something called chronic obstructive pulmonary disease, or COPD for short. This disease is a long-term disease, so um, and it includes both bronchitis and emphysema, which we'll talk about later. And this can cause a person to have trouble breathing because, again, the airways are blocked. So it's hard. Since it's more narrow, it's harder for them to breathe. And some common symptoms that we can figure out that it's COPD would include coughing a large amount of mucus, like more than normal, a tendency to be very get tired really easily. They might not want to eat as much, and this one's probably more common, the bent posture with shoulders raised and lips pursed, because having their shoulders raised and lips pursed, it's like a proper breathing. So unless they're in that position, if they're like crouched over or something, it makes it harder for them to breathe. So they'll tend to go in that position. And then a faster pulse and a round barrel-shaped chest. This we can see in the diagram on the left. On the left is the normal person, and if they have COPD, you start to notice that their chest becomes more roundish and larger than normal, and that's because of the pulmonary disease that we see here. And oftentimes, when with COPD, the person is not breathing properly and not getting the oxygen that they need. So sometimes they are disoriented or confused. So that is something that comes along with this disease. And bronchitis is another illness that causes breathing problems. And so it's the inflammation of the main air passages to the lungs. So rather not the upper airway, but more towards the chest. And this can be both acute or chronic. So it can, in the case of the COPD that we are talking about early, that's the chronic. It will be there for a long time. Or acute, it would just be there for maybe like a couple days or a week, maybe even a month. And so in order to be classified as a chronic bronchitis, they have to be coughing mucus or have a cough with mucus on most days of the month for at least 3 months. And symptoms of this include soreness in the chest, fatigue, body aches, and sore throat. And bronchitis usually develops after a person has had a viral infection because it can move from your nose to the sinus and possibly to the throat and lungs. And so the ones who are most at risk for acute bronchitis include children, infants, the elderly, or people with heart or lung disease, as well as smokers. Croup is an upper airway infection, so this is mainly the throat area where the larynx is. It will actually cause swelling in that area, so the patient has difficulty breathing because the airway is narrowed and it becomes harder for them to breathe. And so croup mainly affects children rather than adults. Uh, Common symptoms would include fever, losing voice, and there's a distinct cough that we can use to identify it. It's almost as if they're choking on something, but they're not. So when they try to breathe, there's a high pitched inhaling sound, or when they're exhaling, they have to like cough, and it's like a barking seal kind of sound. Now, epiglottitis is a similar illness, but rather than the upper airway, it's the infection of specifically the epiglottis, which is basically a flap of tissue in the back of your throat that separates the passageway between the food and the air, so what you eat and what you breathe. And so when we breathe, the epiglottis opens so that air can come in, and when we're eating, it closes so that the food doesn't go into the airway. And when this gets infected, it'll swell to the point where the person will have a lot of trouble with breathing. And epiglottitis is actually considered an uh, medical emergency. So if you notice any of these symptoms, it's good to call 911 and get to the hospital immediately. Uh, Symptoms include fever, sore throat, and again, high pitched breathing because the airway is essentially almost closed, and they have difficulty swallowing, and they start drooling because they can't swallow well, so it becomes stuck up in their mouth. And just for fun, this is an easy way to tell, maybe just from your phlegm, like based on the color, what it could mean about your health. And of course, don't trust this completely, but these are like simple ways that could alert you to medical problems that you or someone you know may have. So if your phlegm is green, it could indicate a cold or flu. Clear is usually healthy, and black would indicate a fungal infection. Brown would be pneumonia. White is bronchitis, and red is usually indicative of blood, so TB or heart failure, which could be severe. And now my partner will take over for the rest of the slides.
Hi guys, Ananta here. So I'm going to talk a little bit about some other breathing emergencies that might occur that aren't necessarily related to COPD, but might be because of other things, such as stress or allergies. So first we're going to talk about hyperventilation. And what hyperventilation is that it's when you really are deeply breathing, it's repeated, it's panicked, and it's usually really fast. So a little demonstration, because I'm not going to do it too much because that's not good. Not good would be like So if you keep doing that and it's involuntary and you can't stop, that would be called hyperventilation. So a person who's hyperventilating is usually hyperventilating because of an emotion, such as excitement. Like if you've ever seen your dog get really, really excited to see you and they start hyperventilating, that's the same thing that a human might do. Or they may be stressed. A lot of times, if someone's having a panic attack or an anxiety attack, they'll be super stressed and they'll start hyperventilating because their body is trying to like combat that stress. And it's important to know that it may stop and it may be kind of breathing may be put back to normal if the person is reassured or and calmed. However, it may not, and that will cause other problems, which we'll go into. So, as you can see in the pictures, someone, is they hurt themselves and then they're hyperventilating, and then, the O2 CO2 balance is off, and then they're feeling sick, and then they can't walk, and it's just a whole mess. So, what you should do first, you should tell the person to relax and breathe slowly if you are with someone who's hyperventilating, and if you're hyperventilating yourself, you should just sit yourself down and try to calm yourself and center yourself as much as possible and just try to regain normal breathing. Second, it's important to know if that a person breathing does not slow down, a more serious problem may be caused, such as dizziness, nausea, and dehydration, and that might be something that causes them to pass out or another issue. So, what you want to do is you want to try to stop the hyperventilation first by yourself by being present and trying to be calm and trying to be a calming presence for yourself or others. But if that doesn't work, then yes, you should call EMT and they'll hopefully be able to give some type of guidance on how to relax yourself. So that's pretty much what hyperventilation is. Now, let's do a little fact or myth exercise. I think you've seen it all over TV. This is also an example from TV, Mr. Sheldon here, to breathe into a paper bag when you're hyperventilating. So take a minute and think you should tell someone who's hyperventilating to breathe into a paper bag. That is 100% a myth. Breathing into a paper bag is going to trap that CO2 that the person is trying to expel, and that's why they're breathing really quickly, and make the situation even worse because then they're going to get dizzier faster. They're going to feel nauseous faster because the air that they just breathe out has nowhere to go. Think of it as like the world's smallest airplane with no filters. That's kind of what a paper bag is. So you don't want to tell them to use a paper bag at all. You just want to tell the person to breathe slowly and try to relax. And you need to be supportive and present. For yourself, too, don't breathe into a paper bag. It's not useful, it won't work, and you probably will pass out. Now, let's talk about allergies. Allergies, we all have them when we go outside and we sneeze because of pollen or the dust that collects in our room. We don't clean it for a while. Anyone can think back to an allergy or have a story about it. What happened? Think about what allergy it was, how it was triggered, what symptoms you felt, or what symptoms the person you are with felt. Some people have really serious allergies, and some people have less serious allergies. So, an allergy is a condition which the immune system, which is the system that keeps yourself from getting sick, reacts abnormally to a foreign substance. Excuse me. So usually, when there's like a piece of pollen or dust, like our body won't react badly because it's just like, some random like object, but sometimes the body overreacts and is like, oh my, like, what is this thing? Like, this is an invader, this is a microbe, this is trying to kill me, and I need to react against it. So then we get this type of response that's called the immune response, the innate immune response. And what it does is that it puts your body into the state where it's just like trying really hard to like expel these toxins, and it's trying super, super hard to kind of keep you, it's thinking it's keeping you safe by kind of closing everything up. So what happens is sometimes your throat will constrict, or you will start sneezing to try to get the toxin out. Something like that will happen. So sometimes allergies are super serious. Like some people have super serious nut allergies, and strange changes in a person after they eat a food or they go outside or something like that could be a sign of severe allergic reaction, such as if you're wheezing suddenly after eating something and something feels quite not right over here, or you feel like you can't catch your breath, like every time you you breathe, it's just not a productive breath. So it's like, it's kind of like that. Or if you get asthma symptoms, like we talked about before, this is known as anaphylaxis or anaphylactic shock. It's when your throat starts constricting and closing up because your body's freaking out because of this toxin. So it's trying to help you by like shutting down and trying to get away from all the invaders. But really, what's happening is that it's like unnecessarily doing this. And why does this happen? People aren't really sure. People just get these kinds of sensitivities and it varies. So I'm not sure if researchers are completely sure, but you can always do research yourself and check up on that. You can always look at the CDC or the WHO, and maybe they'll have some information for you. So, what you should do, you can use an EpiPen. Using an EpiPen is a shot of epinephrine. And epinephrine does the opposite of what your immune system is doing. So it opens things up. It gets you ready for like a fight or flight response, which is something that we have, if you must know. It's like what we used to use when we were like hunter gatherers back in the woods. We would either like fight the bear or we would flee from the bear. And epinephrine is that molecule in our body that allows us to do that. So if someone's having an allergy attack that involves a breathing emergency, if they have an EpiPen, you can use it to help them until EMS arrives. So here's how to use an EpiPen. If you know someone has an allergy, you should ask if they have an EpiPen. And if you have an allergy and you have an EpiPen, you should for sure carry it around.
How to use EpiPen on someone else. If your child or someone you know has severe allergies, it's important that you learn how to use EpiPen correctly. That way, you can feel more confident and prepared in the event of a severe allergic reaction. In the case of an allergic emergency, every second counts. That's why EpiPen should be used at the first sign or symptom of a severe allergic reaction. Just follow these 2 simple steps. Grasp the EpiPen autoinjector with the orange tip pointing downward. Blue to the sky. Remove the blue safety cap by pulling straight up. Do not bend or twist it. Orange to the thigh. Place the orange tip against the middle of their outer thigh. Swing and push the orange tip firmly into their mid-outer thigh until you hear a click, and hold on their thigh for 3 seconds. Count slowly. 1, 2, 3. EpiPen will work through clothing if necessary. After EpiPen is used, the orange needle cover will automatically extend to cover the needle. This safely covers the needle as the autoinjector is pulled away from the thigh. You will not see the needle before, during, or after use. The extended orange needle cover and black indicator in this window will show you that EpiPen has delivered its epinephrine. Remember that using EpiPen does not replace seeing a doctor or going to the hospital.
So that's a little bit of background on how to use the EpiPen. So yeah, you just keep it straight, you untwist, and then you just jab it in someone's thigh. Some people might think it's better to jab like somewhere else, but usually we jab in the thigh because it's like fleshy, it's easily accessible, and it just hurts less. And when someone's like having an allergic reaction, like they're not, you want to make sure that you don't distress them anymore. Of course, you should also call EMS for someone or drive someone to the hospital if they're having a breathing emergency, but this is just a good intermediate step to keep their throat from closing up and keep them from going into shock before you get some other kind of help. So, when to call 911, what to do in a breathing emergency. First, the most important thing is don't ignore your symptoms or let others ignore the symptoms around you. You need to be attuned to what's happening with your body. If you notice that either you or someone around you is having difficulty breathing, it is better to assume it is an emergency than not, and then maybe like risk them being really sick or risk you being really sick and then something worse happens. So you always want to err on the side of caution. You always want to give us the benefit that this is an emergency and that it's better that it's not an emergency and you thought it was and then you were prepared than it was an emergency and you weren't prepared. The biggest red alert symptom is shortness of breath, right? Kind of like what's happening with SpongeBob over here and what's happening with these lungs. Not that much is going in. There's not that much O2 going in. They're winded. They're having a hard time catching their breath. And that is a problem because that happens out of nowhere. If you just like were sitting and or like eating a food or just like, I don't know, just like staring out the window and suddenly you feel the shortness of breath, like there was no reason for that. You weren't exercising, you weren't like jumping up and down. So what is causing this? Probably some type of breathing emergency. Maybe it's a hyperventilation from the panic attack, or maybe it's that anaphylactic shock from an allergy. So you want to make sure that if you ever see shortness of breath, it's a red alert system. So if you experience shortness of breath that is so severe that it interferes with activities of daily living or function, like randomly, then you need to call 911 for an ambulance or have someone drive you to the ER immediately. This is the same if you're doing some care for someone else. If you notice them not being able to breathe, you should call 911 right away, and you should like just make sure that you are being proactive because this might just escalate into a more difficult situation. While waiting for EMS, don't exert yourself or the person. Just let them sit down, have them try to breathe normally. Don't give them any water or anything. You don't want to do anything except just have them relax as much as possible while they wait for EMS, because you don't know what the problem is. You don't know the best way to deal with it. I don't know what the problem is or the best way to deal with it. So the best thing you can do is just make sure that they don't make the problem worse by exerting themselves. So you can see here this lady, I mean, maybe she was running, maybe she was just, walking around and she suddenly is feeling the shortness of breath. You can see it's a classic position to kind of lean forward on your knees and like try to breathe. So what you would do is you would just tell her not to exert herself, maybe sit her down on the floor, and then call for 911. If a person you are with passes out, call 911 like you already had, get the AED, or have someone else get the AED. You can just be like, you get the AED and call 911, or you get the first aid kit and the AED. Be very pointed, avoid the bystander effect, and begin CPR. You can watch some of our other modules to see how to begin CPR, but that's what you would do in case they pass out. And make sure they're passed out, check if they're breathing, and see if their chest is rising. So that's pretty much what we have for you today. If you have any questions, you can email us, DM us on Instagram, or DM us on Facebook. We're pretty responsive. Thank you so much for listening. And if you have any questions, you can definitely reach out. Please don't hesitate. And I hope you learned something. Thank you so much. Bye-bye.